happy and profitable week of awareness of diabetic food. I'm Roberto Anichini, diabetologist, past president of Diabetic Food Italian Study Group, and actual chair of European D-Food International. I'd like to introduce the brief presentation with a little story of how 40 years ago I began to work with diabetic food. I'm live in Tuscany, Italy, the land of Pinocchio. I think that you know a story of Pinocchio, the story of a wooden puppet. Then, one day, while he slept in front of a fireplace, his wooden feet began to bar with his inability to feel a pain. Well, 40 years ago, I saw a diabetes patient that have lived the same situation for his inability to perceive a pain. And this situation touched me in my heart and my mind. And I decided that my role as a doctor would be to fight diabetes and its devastating complication. In this year, were changed many things. In that period, as diabetology, many years ago, we took care diabetic food because nobody want to look at this patient for a complex of case, for a long hospitalization, for a very poor outcome. So our objective in this year was how to improve a care of the food. I think that in this year, the most important aspect that has been development are a multidisciplinary approach of the care. Different professionals working in taking care of the patients with diabetic food. Nurses, podologists, podiatrists, educators, diabetologists, surgeons, and other different professionals to change the story of diabetic food. Different competence with the same objective to improve diabetic food care. In this year, we improve our approach in the care for preventive fast ulcer, ulcer healing, remission, rehabilitation, recovery of working ability. But the most important achievement in food care and improving outcome in the prevention and amputation for me is now the collaboration with the vascular surgeon, with the hemodynamist for effective revascularization for our patients. The same compression of a problem, the same objective in the outcome. Finally, what kind of message for this awareness week? For professionals, we can improve the natural history of diabetes food. We have the sufficient skills, knowledge, behavior to improve outcome and to reduce amputation. For patients, the professionals have the competence and the instrument to fight diabetes food. But we need that they implemented the same aspect to prevent and taking care quickly patients with diabetic food. Remember that they must consider diabetes as a whole. For example, metabolic control at the first moment where the diabetes presents. So they could improve result against diabetes and to prevent diabetes food problems. Good weeks of awareness of diabetes food. Thank you for your attention.